Hi, I'm Whitney Coker. This is my Week 4 skills video, mouth care to the unconscious person. My first step is to knock, identify, and greet the resident. So I would knock, letting them know I'm coming into the room, identify myself. Hi, Mr. Smith, I'm Whitney, and greet the resident as well. Then I'll explain the procedure. I'm going to be giving you mouth care today, Mr. Smith. You still talk and treat the resident as if they were conscious, but you don't ask questions because they are unconscious and aren't able to reply to these questions. Then I would perform hand hygiene before touching the patient and before touching any of my supplies. I would have gloves. I have a box of gloves right here. My ordered oral care cleanser, a cup of water, a padded tongue blade, mouth moisturizer, and mouth swabs with a little sponge at the end. They're basically just Q-tips with sponges at the end. And I would also have my kidney basin. So after I have all of my supplies, I would then raise the bed rails on both sides. And then I'm going to return to the side that I'm working on, which just so happens to be this side. I'm going to move the call light out of the way. And I'm going to grab my towel, unfold it, not shaking it, and I'm going to, first, before I do that, I'm going to lower my bed rail, then turn my resident to the side. Mr. Smith, I'm going to turn you on your side now. And if they couldn't be supported like this, you could always put a pillow behind them in order to keep them on their side. Then you would unfold and place the towel on the pillow, bed, and under the chin. That way you protect water from getting on their bed and pillow. And then I would put my supplies on the towel and place the kidney basin under the chin of my resident, Mr. Smith. And then I'm going to put on gloves. Because when performing any personal hygiene care to a resident, you want to keep gloves on, even though you've performed hand hygiene, just to make sure you don't contaminate your hands. After you put your gloves on, you're going to grab a sponge, dip it into the cleanser, squeezing off any excess, and when you squeeze, you also make sure that the sponge of the mouth swab doesn't come off, because if it were to come off in their mouth, then they could potentially choke. Next, you're going to clean the chewing and inner part of the teeth. And then you're going to set that one to the side, grab another one, dip, and squeeze off excess, making sure each time you do this, you make sure that the sponge of the mouth swab doesn't come off. Then you're going to clean the inside of the cheeks and the roof of the mouth, making sure you do so thoroughly, and then around the gums. Then you're going to grab another mouth swab, dip, squeeze, and then I'm going to clean the tongue and the lips. And then after I'm done with that, I'm going to make sure my dirty sponges are separate from my clean sponges. Then I would grab a clean sponge and dip it into the water, squeeze, and rinse any surfaces that I just cleaned. When I'm done with that, I'm going to remove the basin and pat the mouth to remove any excess water, keeping that part folded in so it doesn't contaminate any other areas. After I'm done with that, I'm going to move my used supplies into the basin. And I cannot forget to apply my mouth moisturizer, and that would also go into the kidney basin once I was done. And then after I removed all the supplies into the kidney basin, I would remove my gloves. I didn't mention this, but if the resident is unable to if their mouth is unable to stay open, you would use a padded tongue blade to hold it open. And then you would put the kidney basin back onto your table for discarding later, and then you would fold the towel into itself, making sure the contaminated part is not the part you're touching and that you're touching the other side. And then you would put the towel into the linens basket, the dirty linens basket. After you're done with those steps, then you would reposition the resident, providing good alignment. Mr. Smith, I'm going to lay you back on your back, making sure the resident is comfortable. And then, even though they're unconscious, you still place the call light within reach, because they could wake up, or they could also have family or friends visiting that needed something, and so they could press the call light if they did. And then once you're done with that, you perform hand hygiene, and then you report and record any observations.